Now, another thing that we can do, which is um, more of a trigger point therapy kind of thing, is to do elongation around that muscle fiber, right? So we find that knot and we figure out which way this is going. So infraspinatus, we know it's going to come across this way. So the fibers are probably going to run mostly horizontal, maybe a little bit at an angle upward superior. So we're going to find that and we're going to work from the, wait, you relax. I'm working, you're not. And we're going to work from the insertion back towards the origin, trying to elongate those fibers.
Do you normally not do lotion?
I'm going to put a little bit on, but I didn't want to put too much on.
Not trying to correct you. I'm just wondering.
Well, if you're holding a point, if you're doing deeper work, you don't want to slip and slide everywhere. You want to be able to hold your point. So I tend to use a lot less.
Okay.
And I tend to use it sparingly, just so I can get where I want to go. So elongation strokes. Some people kind of plant their hand and just push across for an elongation. I kind of like using my fingers though. I feel like I know where I'm going. Now, again, you guys really want to think about your body position. You want to be facing the direction that you're putting the pressure. So if I'm going from the acromion or the head of the humerus, and I'm going to be working this way, my toes, my hips, and my shoulders, and my fingers are all going to be pointing in this direction. So this would be like an elongation stroke. Okay. All right. Now, how do we know what's happening over here on the lateral border? What's a good way to kind of figure out which muscle we're on and how it gets? Number one, we know teres major is going to be chunkier than teres minor, right? And we know that teres minor is going to stay posterior and teres major is going to duck under with latissimus dorsi. So it's going to do a little bit directionally differently. So the action of teres major is going to be medial or internal rotation, and the action of teres minor is going to be lateral or external rotation. So we're going to have her bring her arm down, and I'm going to have her press against the leg of the table, or you can have them press against your leg, whichever. Okay, so that's going to engage rotation medially, and so we're going to see more of teres major engaged, and then if I have her bring her hand behind and push this way, then I'm going to engage teres minor. Okay, so you can see the different engagement happening. Okay, so relax. All right, so depending on which direction we're moving, we go. Cool. Then we'll get those muscles to engage, right? So depending on which way her arms are moving or which way she's pushing against us, will engage different muscles. So it's easy to tell here on the lateral border, on the lateral border, which muscle we're working on. So with the rotator cuff, we want to be concentrating on teres minor, which is the higher one, and the one that stays posterior. So we're going to move along it, see if we get any. Any, right? Yeah. So, she's got more going on really here than she does in infraspinatus. So we're going to just try to loosen it up a little bit, nice and gently, and then we're going to come in and just hold the point here. Is that okay?
I'll feel it in my glutes.
Yeah. Okay. So we're going to hold. Is it intensifying? Yeah.
Preserve.
Keep breathing. Nice deep breath. Okay. Is it changing at all?
My arm's going down.
Your arm is going down. Okay. This. How's that? Better? Okay. Are you still intensity-wise? Are we lightening any, or is it same as lightning? Lightning. So we want to just hang here for a little while and let the intensity lighten.
And your pressure, you're basing it just on how it feels.
Yeah, I mean, there's
Is it
some
resistant?
resistance here,
Okay.
so yeah, I'm not,
And that's
again,
good.
I'm not a like no pain, no gain kind of person.
Mhm.
I really don't feel like beating up on somebody is like super beneficial for me. If I'm causing them that much discomfort, they're gonna tense up and it's gonna really make my work harder. So, all right. Okay, so now as we roll across this, how's it feel? Better? Okay. So I feel like there's some going on here too. Yeah. Okay. So I just moved slightly laterally to catch more of this fiber, and I'm doing the same thing. So how you feeling?
Is it shooting down your arm? Was it?
Yeah, it might be shooting down our arm. Okay, and we're gonna just hang here, see what happens intensity wise. Is it lightning on you? Okay,
It's going up my neck.
it's going up your neck.
And it's okay for them to react. Like if they react,
Sure.
like to not like halfway like,
Yeah,
oh
I mean,
gosh,
you don't want
know,
them
like,
to jump off the table and run out of the room.
right?
Kind of.
But it's okay. Like it's gonna be it's gonna be uncomfortable.
Shush.
Just wrap it down.
Hold on.